Hello everyone, welcome to radiology tutorial. Today we are going to discuss the ultrasound of female pelvis. In this video we will discuss the probe positioning technique for the transabdominal scanning of the uterus and ovaries. So first of all, here we can see the graphical representation of the probe positioning for the transabdominal scanning, and this is the adjacent sonogram for the female pelvis. And now here we can see the umbilicus, and this is the inguinal canals, this is the pubic symphysis, and this one is a transducer. And here we can see the head or the orientation marker of the transducer. For the transabdominal scanning, the orientation marker should be toward the head. Start the scan by placing the probe in the midline in the suprapubic area, and look for the bladder in the longitudinal scanning with the uterus posterior to it. As here we can see, this one is the urinary bladder and this is the uterus. Here we can see the cervix and this is the vaginal canal. Try to get the transducer parallel to the uterus for the optimal imaging by heel to toeing the probe. For example, if the uterus is anteverted or anteflexed, then heel the probe, and if the uterus is retroverted or retroflexed, then to the probe. Here we can see the endometrium of the uterus, which is surrounded by the myometrium, and always measure the thickness of the endometrium in the longitudinal scanning and do not include any cavity fluid in the measurement. The normal values for the endometrium is less than 15 mm in the perimenopausal and less than 5 mm in the postmenopausal woman. And now here we can see the graphical representation for the lateral view of the uterus in the longitudinal transabdominal scanning. Now keep the probe in the longitudinal position and scan out towards the both adnexa by tilting the probe laterally and using the bladder as a window. While doing this, observe for any fibroid or the ecotexture abnormalities within the myometrium and acquire the representative images of the left and the right lateral aspect of the uterus. And now here we can see the adjacent sonogram of the uterus and the longitudinal transabdominal scanning. And here we can see the uterus, and this is the urinary bladder, and here we can see the right adnexa, and here the small follicles are also seen. And now we are going to discuss the probe positioning technique to visualize the right and the left adnexa. Scan out further laterally on both sides into each adnexal regions and look for each ovary in the longitudinal scanning. The internal iliac vessels are the lateral boundaries of the pelvis and are useful landmarks to help to locate the ovaries. If the bowel gas is obscuring the image, try to displace it by pressing with your free hand and try to find are there any solid or the cystic adnexal lesions. Acquire the representative images of the left and the right adnexa and ovaries if identified. And here we can see the urinary bladder, and this one is the right adnexa, and these tiny cystic areas are the follicles, and these follicles can be differentiated from the bowel loops, and it must always be rounded in both planes, longitudinal and the transverse, and these does not show peristalsis. And after menopause, the ovaries atrophy and can be hard to see. In these cases, the aim of the study is to simply to exclude any adnexal mass. And now we are going to discuss the transabdominal transverse scanning of the female pelvis. For the transverse transabdominal scanning, turn the probe 90° in the anti-clockwise direction, and the orientation of the probe should be toward the right side of the patient. And here we can see the adjacent sonogram, and this sonogram shows the urinary bladder and the uterus, which is posterior to the urinary bladder. And here we can see the right adnexa, and this one is the left adnexa, and bilateral adnexa are showing the small follicles which are visualized here. In the transverse plane, we have also scanned through the uterus from the vagina to the fundus by tilting the probe inferiorly and superiorly. And now we are going to discuss the probe positioning technique to visualize the right and the left adnexa in the transverse plane. To visualize the right adnexa, place the probe lateral to the uterus at the site of the right adnexa and tilt the probe laterally using the bladder as a window. Similarly, to realize the left adnexa, place the probe at the left adnexal site and the orientation marker of the probe should be toward the right side of the patient. As here we can see the adjacent sonogram to realize the right ovary and the transverse plane. Here we can see the urinary bladder which is adequately filled, and here we can see the right adnexa which shows the multiple maturing follicles. The same technique is applied to realize the left adnexa.